As the UK's daily death rate from coronavirus has this week fallen to its lowest level since lockdown began, is there finally some good news on the horizon?
Well, as hopes of a vaccine increase, Dr Philippa joins us this morning to explain the science behind some of the recent developments. Morning, Philippa.
Good morning.
Lovely to see you again. Thank you for joining us. Let's talk about the vaccine. You've got a pharmaceutical giant agreeing to deliver 300 million vaccines to EU countries. So who's working on it? How far have they got? How soon can we expect it? Because in the past, we'd be waiting 20 years for one of these.
Absolutely. Had we been talking about this a couple of years ago, I'd have been saying 4 decades. And now it's so astonishing, actually, that people all around the world are working on it and moving quite quickly. I mean, there were reports today that a Chinese company has come out with a new vaccine which potentially could produce antibodies in 90% of people. But in the UK, we've got 2 big contenders. We've got the Oxford University trial, which is already in human trials, and Imperial College in London, who are starting human trials this week. 2 world-renowned organisations moving amazingly quickly.
So how close are they?
So the Oxford trial is using a traditional method of a vaccine. It is putting a harmless virus and it's modified it to have the coronavirus sort of spikes and proteins on the outside, so that when you inject that into the body's immune system recognises the coronavirus spike. Now, they're already in human trials and they're saying that they hope to be ready by September. I think that's really optimistic. The second study is the Imperial College study, and that's using a new method. It's called an RNA vaccine. And RNA teaches your own body to code a protein. So it's teaching your body to code that same spike that would then produce the antibody response. That starts a small human trial this week, and if all goes well, it will start a trial of thousands in the autumn. They're saying that they hope to have results by early 2021. And I think that's more realistic. We're not just talking about a vaccine that works, we also need a vaccine that is safe.
And so once this safe vaccine becomes available, who will be the first to receive it?
So it hasn't, obviously the guidance hasn't come out yet, but one would assume, first of all, you would put your frontline workers, your NHS staff, your care home staff, and then the people who are most vulnerable to complications of COVID-19. So the people, for example, whose immune systems are compromised or suppressed. But we need to know how those compromised immune systems will respond to a vaccine.
And do you still... I mean, obviously, this is early days. We don't know. We're desperately clinging for any good news that we can find, which is why we want to talk about this today, because, you know, there are countless incredible scientists and their teams working on this around the world. So you've got to hope that somebody gets it, you know, as quickly as possible. However, back to the sort of reality of the winter time, do you get your flu jab still?
Absolutely. We are a world in lockdown for the lack of one vaccine. So we have to prevent everything else that we know that we can. Flu season, for me, my big concern is about a spike of coronavirus in the middle of our seasonal flu season. So if you are eligible for a flu vaccine, I really encourage you to get it this year.
When you mentioned that, Philippa, can you explain this second catastrophic to the NHS spike? Because, yes, flu is seasonal and it's going to happen again in the winter, as it always does. But at the same time, we know what to expect from COVID-19. We understand it now. We know who it affects. We've got the PPE and the beds and the ventilators and the Nightingale Hospital. So whereas we didn't know what the hell was coming when it first came, now we know it. So why will there be a catastrophic second spike for the NHS?
We don't know whether or not there will be, and we definitely hope that they won't be. But it's not just about supplies. So yes, we are much better informed. We have a swab test, which we didn't have before. We have an antibody test. We are further along in trials of treatment. The Nightingale Hospital is ready to go. Yes. However, we also have to take into consideration things like the behavioural science. Will people tolerate a second version of lockdown? Would they then follow the rules? And if they don't, then that combination of coronavirus plus flu could well overwhelm the NHS.
OK, let's change tack a little bit here. Some good news. Northern Ireland becomes the first part of the UK to announce changes to its coronavirus regulations in as such that pubs can now open from the 3rd of July.
Yep, so pubs in Northern Ireland, the beginning of the opening of the hospitality industry. And for me, as a doctor, my concern there is what happens towards closing time. Are you still going to be aware of that 2-metre rule? And when we talk about the 2-metre rule, and I know we're going to cover it about whether or not there's science behind it, again, we have to put in people's behaviour. If we say 2 metres, are people really doing 1 metre? And so as it comes towards closing time and perhaps you've had a few, are you going to really stick to those rules? And so that's my concern. And to be honest, I would prefer right now that you put the children back into school.
Let's talk about the 2-metre rule, though, because writing for The Telegraph, Professor Carl Hennigan and Tom Jefferson from the University of Oxford have said there is little evidence to support the restriction and called for an end to the formalised rules. So what's the point?
So what they were looking at was a recent review of all the science that we've got around 2-metre rules. And actually, of the 172 studies that they looked at, only 5 were dealing explicitly with coronavirus. So we are extrapolating a lot from what we know with other viruses and bacterial spread. And what it seemed to show that with regards to coronavirus, 1 metre is the really significant value here. And the University of Dundee showed that at above 1 metre, that below 1 metre, you've got about a 78% chance of infection, and above that, that goes down significantly. But again, if we say 1 metre, are people going to do 50 centimetres? And if we say 2 metres, are people going to do 1 metre? So it's not just about the science of the transmission of the virus, it's also about the science of people. So we wait and see for more research.
All right, thank you very much indeed.
Thank you.
Talk to you.
Thank you very much.